So we're going to talk about the breast and axillary examination. This is something that you will not be tested on, but we do want you to understand what this is. Again, the likelihood of you doing a breast axillary exam is only going to happen if you choose to work in postpartum, labor and delivery, or you decide to go back to school like me and focus on women's health. Then life will be full of breasts and all of that stuff. And you will relearn that at that time. But I want you to understand the basic concepts. So a few things, our patient, we've already done A&O and cap refill because we do that with everything. I always do that. Thank you so much.
Look, and I washed time to do my capillary refill while my boobs are out.
Okay, I'm sorry. I won't, because normally the patient would be covered, but because her breasts are available, we're going to just use them. Just so you know, this is not a pornographic film. These are fake breasts that she has nicely decided to wear for us. Be happy you're not in lab with all of us because we all would each be wearing these. So there you go. All right, including you. So one of the things that I would like to remind you, if you make the boys put it on, I do too. Sorry guys, Joshua, you've been saved. Okay, I have two Joshuas, so there you go. And Chris and Adrian, and I'm trying to think of all the names. I think I got Adrian. No, I got Adrian right. Okay, all right. So one of the things that's really important, and I'm going to show you on me really quick, is that we do you remember the epitrochlear nodes that we talked about way back when? So epitrochlear nodes, you want to start, my elbow is here, and you start about halfway up, and then you go all the way up into the axillary area. So you're going to see me do that on her when I'm doing the breast exam. You're also going to see that I'm going to have her do movements. You're not going to be able to see it the same because it's here, but when you're doing a breast exam, you want to have the patient face you. You want to have them put their hands on their waist. They shrug their shoulders forward, and the reason is that then the muscles underneath the breast tissue actually change the way the breasts appear. If you see any dimpling or puckering, then that's what we're looking for. That means that there's something attached to the muscle wall doing a little bit of a pull. So I always joke that I want to see dimples on someone's face when they smile. Some little babies have cute little dimples on their patootie. That's all fine and dandy. I want to see it there. I do not want to ever see it on a breast because that means that, again, something is attached to the muscle wall and is pulling against that, causing that skin change, okay? You do want to look at the breast first. You're observing for any type of, you're looking for any type of skin changes. Puta orange is the one that we talk about probably the most, and that is where it looks like the skin of an orange, not the color orange, just the skin texture of the orange. And so you would see that when you're looking at the breast tissue. You want to make sure that whatever the nipples are doing, that it is normal for the patient. Sometimes one nipple is mildly inverted, like this one is here, and then the other one can be completely not inverted. Perky, and that is completely normal. You want to know what is normal for the patient. But if when they put their hands on their waist, they shrug their shoulders forward, and you have some dimpling or changes, or one breast nipple goes a completely different direction, then you want to realize that that, again, is something potentially pulling behind the scenes. You also want to have them raise their arms. The reason is that when they raise their arms, again, you're going to have some pulling on that muscle. And so if something is there, you will potentially see a skin change. So I encourage you to practice in the mirror, to do a self-breast exam at home, boys included, men included. Men do get breast cancer. So you always want to remember that, okay? And always encourage men to do self-exams as well. Maybe not every month, but that's fine. According to your textbook, I'm going to get this wrong because I always get it wrong, because I was taught a little bit differently. But the best time to do a breast exam is 2 to 5 days after your period starts. I believe your book says 3 to 7, something like that.
I usually say a week after.
A week after. So. And the reason is the breasts aren't as full, they're not as tender, they're easier to feel. So that is actually the best time to do an actual breast exam, okay?
You'll actually get cystic changes that you'll actually feel and think that they're a tumor or a mass, and then you'll come in, and by the time you come into the office to see someone, it's gone because the hormones have already reduced and it's gone back to normal. So that's why it's best to do it a week after.
And sometimes what we do is actually I'll do an exam and then have a patient come back 2 weeks later so I can feel the difference and understand what types of changes those are. Okay? So Hi, Professor Ross.
Oh, hi.
Hi, how are you? I'm going to go ahead and do a breast and axillary exam today.
Great.
Okay, so if you can fully sit on the bed.
Yes, ma'am.
Okay, I took a 10-hour class on how to do a 45-minute breast exam. So I hope you all are sitting down. It'll take 5 minutes, don't worry. Hi, I'm here to do a breast exam. We're going to do that.
The class?
I did. It was just, sounds, amazing, right? I'm going to just steal this arm and I'm going to place this right here. I'm going to go to her epitrochlear nose. Her breasts are falling down.
Sorry.
And again, I'm going to palpate. Typically not over close except for the armpit. We talked about how we do that where you put the tissue or their t-shirt, something. But you're palpating just for pain centers, not grabbing like this, but just palpating. And then place your fingers up in their axillary area and you're palpating up into their armpit. You then go to the other side and do the same thing. I always have them rest their arm here, and that way I have full control over their arm, and I'm again feeling and palpating for any changes, okay? If you can go and put your hands on your waist for me, and if you can bring your shoulders forward, notice how her breasts aren't moving. That's why I showed you independently. Go ahead and lift your arms up over your head, and I'm looking to see if there's any nipple changes, skin changes, anything like that. I've observed, go ahead and relax. I've observed her breast. She does have a little bit of skin change here on the external area. If you can see that just on these sample breasts, she does have a little bit of a skin change here that is not consistent with the other breast. So I would then ask her, please excuse me, I would then ask her if that was a normal change for her. If you can go ahead and lay down for me, great. So yes, shoes off, please. These are clean beds. Okay, if you want to come over here, that would be great. You want to lift the arm up over the patient so that they can, and if for any reason they can't, just as high as they can go so that you can do an exam. For me, you want to go up to the clavicle and you want to do the supracervical lymph nodes. You've already learned about those, and head, face, neck. So double check those supraclavicular, excuse me, I said clavicle, I think, clavicular. And then I actually start at the sternum personally. It doesn't matter if you start there. You're going to see various methods. There's a circular method where we go around. There's an up and down line. There's one where you go like this. I am a linear person. I was taught that way, and I was also taught that you get the most skin coverage. You use the pads of your fingers, the 3 fingers here, and I start at the sternum and I go all the way up. Remember that the breast tissue is not just this. It is actually a full teardrop that comes up to the clavicle area. So you want to just palpate and go up in linears. I'm so sorry if this is hurting.
It's choking.
Is it choking you?
There you
okay.
go. Okay, I got it now.
Okay,
Go.
so your breasts are now at your abdomen. That's great. We need to discuss more
I'm older.
support
I know. I need more
bra.
support. Sorry.
And I'm just feeling all the way down. Okay. These breasts are a little harder to palpate. They're more difficult, and you will find that. I'm doing 3 small circles to palpate and get all the way down deep. These breasts are not acting like typical breasts would. So please realize that. But I'm still using the pads of my fingers, and you're just going all the way up to the clavicle because, again, that breast tissue goes all the way up to the clavicle. So you want to make sure that you're doing that. You're seeing this hand moving because I'm moving breast tissue out of the way, and I'm going all the way up. Okay? So then I would go ahead and do the other side. So you want to go ahead and relax this arm down. We're going to do this breast. I, on the other breast, go all the way to the other side. That's how my muscle memory goes. And I just go up and continue to do the same breast exam. What you want to realize is that you can squeeze the nipple when you get there so that you can make sure that there's no expression of milk or blood. I do that right at the end on both exams. Realize that when you do a breast exam, sometimes that can increase the expression of any milk that they may have. So just be aware of that. If you have any questions, again, we'll go over this when you are in lab together or when we meet on Zoom. But again, you are not tested on this information. Go ahead and bring your arm down. Go ahead and sit up. Great. Thank you so much, Professor Ross, for allowing us to examine your breast. Yes.
My last little tidbit, too, is that the most common place for breast cancer is typically in this like pie-shaped area here that goes into your armpit. So make sure that you are checking this part really well, because that is the most common spot that you're going to find something.
Test question, upper outer quadrant. And the reason, by the way, that we checked those lymph nodes, thank you for the
Just
reminder.
fell off.
They did. That's horrible. Oh my goodness. Is that the breasts drain into the lymph nodes. So sometimes that's the first sign that something is actually wrong, is when that breast has drained into the lymph nodes. So again, if you have any questions or problems, let us know. Thank you so much. Bye.